In this video, we're looking at taping for medial tibial stress syndrome, commonly known as shin splints. It's actually taping for tibialis posterior pain. When patients present with pain around the medial side of a shin, it could be coming from a multitude of areas. One of them is actually coming from the actual medial part of a bone. This is known as a medial tibial stress syndrome, and it can either be from the tibialis posterior, the flexor digitorum longus to the digits, or the flexor hallucis longus to the great toe. It can also, where these muscles attach, cause a periostitis on the medial part of a bone, and actually could lead on to a condition known as shin splints, and in common terms a stress fracture could lead on to. So the two bits of tape are prepared. The first one is a standard eye strip, and the second one is an eye strip cut into the shape of a Y. So tibialis posterior goes to the navicular, and it's responsible for plantar flexion and inversion. So we're going to bring the foot up into dorsi and evert to stretch it. So if I just mark roughly where the pain is located, let's say the pain is located just where that sticker is located. Turn the tape over and split the first square and apply that onto roughly the navicular tuberosity and pull it so it breaks the back in. Peel it back to the first square. Use your two fingers, lock it down. What we can do when you lock it down is little stretch, 10%, and try if you can to mold the tape posterior around the medial malleolus and have it coming up across the actual area of pain, like so. And then use the back of the tape. I can heat activate if I wanted to. Right, we've lost where the pain is now, so we can actually, let's go back to where the pain is located. So let's say that's where the patient presents with pain. So using the second eye strip, that's now a Y, split each of the legs and apply the pad posterior to the pain, like so. And then what we're going to do, if you just notice what I did, just literally pull it so you can break one of the legs. Excuse the expression. And then roll the leg inwards, if that's okay. So what we can do now, we can use your fingertips to pull in the muscle a bit, 75% stretch, so 100 back off to 75. And as it comes up on the lateral side, you can just ease it off and mold it around. So that's the first one. And then the same on this one. So pull in the tissue, 75% stretch, and then as I bring it round, I can ease her off a little bit if I roll his leg that way, like so. Using the back of the tape, just to heat activate the glue, just to make it a bit stickier. And there you have kinesiology taping for any form of medial shin pain.